We are Gold Ivy, a health company dedicated to simplifying health and wellness. The industry is lacking the honest experience and grit required to overcome the struggle, and we're here to fill that gap.
You decide what works for your daily life and how to transform our lessons into your gold. Join us on the fearless pursuit of self-discovery and growth.
This is Ivy Unleashed,
A Gold Ivy production.
Welcome back. You are listening to Ivy Unleashed. As always, we are so grateful that you are here with us today.
Welcome.
Today is a very, very exciting day because we have in studio our first ever doctor on the show.
Yes.
A lot of you guys know my story and how familiar I am with doctors. However, unlike what I've shared before, I am so excited to pick the brain of this doctor. Because today we're covering a topic that everyone wants more of, something that we can't get enough of, we stress about, we crave. But before we jump in, I just want to note, little disclaimer, the information that you hear today should not be taken as medical advice. The content here is for informational purposes only, and because each person is so unique, please consult your healthcare professional for any medical questions.
All right, so let's get into it. I want to introduce to you, everybody, Dr. Hron of Internal Medicine at the University of Minnesota, or can we call you Dr. Danielle?
You can just call me Danielle. I feel like, we're friends talking about stuff that's fun to talk about and will improve our lives. So just Danielle's fine with me.
Okay, awesome. Well, thank you so much for being here. I think, as Brooke was saying, this is a topic that we haven't jumped fully into yet, and it's a topic that everybody's asking for us to cover, which we planned on anyway, but it's like, okay, we hear you. We are going to be talking about...
And we're going to bring a doctor in to talk about sleep.
About sleep. I know that sleep is a passion of yours, so how did you get interested in it?
Well, being a doctor and training to be a doctor is something that is extremely time-consuming and takes a lot of energy, especially cognitive and mental energy. And as if going to medical school wasn't enough to take up all of that, I also decided that I was going to compete in beauty pageants, Miss America and Miss USA during medical school. And so I needed a way to optimize my energy, my productivity, and I had a really conveniently timed rotation in sleep medicine. And it was just so eye-opening. Some of the tips that we were talking about with patients when I would do reading at home to study for it, the things that I was learning, and I was just like reading all these science words and I was like, oh my gosh, how can I apply this to my own life to be more productive? And that rotation ended up being more helpful to me than it probably was to the patients. And it was always really funny because when I was competing in pageants, that's really time consuming. You're doing charity events, probably 20 hours a week. And people would be like, oh my gosh, how do you do it all? You must never sleep. And I was like, you could not be more wrong.
That is the secret.
That is my secret. The secret is not that I never sleep, but actually that I sleep a very adequate amount and good quality sleep.
Really? How did you make that happen?
Well, we'll get more into that today. I have a lot of very easy, applicable strategies that we'll get into. And then after that initial sleep medicine rotation, it was kind of funny and probably a scheduling fluke, but I ended up having almost 12 weeks of sleep medicine rotation throughout my time during medical school and then also in residency, which is just actually an astronomical amount for
Not
just
normal.
Yeah, for general internal medicine. Usually like someone who is going into a sleep medicine fellowship might have that much. But for whatever reason, I got lucky and my schedule included that. And I was like, this was meant to be. And I loved it. So I just leaned in every time and got everything I could out of each educational experience.
Yeah, I would love to know kind of from a scientific perspective and what you had learned, going back to the basics of why sleep is so important.
I love this question because it's incredibly important and it gets at a lot of the things that are super scientifically interesting to me. But to put it in, normal language instead of nerd language, sleep is really important because overall it reduces the inflammation in your body and it repairs blood vessels. And while you sleep, your blood pressure actually goes down. And this is really important to reducing risk of heart attacks and stroke. And actually in the Journal of Sleep Medicine, which is like a research journal that's peer reviewed by the scientific community, it shows that people who get good sleep, enough sleep, good quality sleep, overall live longer. And that people, specifically women with stress, are more likely to develop sleep problems. And so that tells us that stress and sleep problems lead to health problems overall and an overall increased rate of mortality. Other reasons that sleep is important is because it consolidates learning and memory and your cognitive function. So if you've ever felt like you're just in a fog and you're forgetting things or you can't seem to keep your life together, it might be because you're sleep deprived. And sleep is incredibly important to brain health overall. Chronic sleep deprivation is actually associated with an increased risk of dementia later in life and other cognitive impairments and things like that. And of course, poor sleep is also associated with weight gain and diabetes and all kinds of health problems. Not to mention that you just feel like total garbage.
Right. I was going to say that. It's like, I don't even know if we need all these reasons, but I think people do push it off. Like, you know you're moodier, you feel like crap, you're less likely to work out if you're tired and you treat people poorly because you're so irritable. But then all of these things on top of, like, I didn't know that was connected to dementia. Like, that's super scary. That freaks me out.
Yeah. When you sleep, there's this protein in your brain. It's called tau protein. And when you sleep, it clears it out. So it basically detoxes this protein out of your brain. And we've found that in patients who have dementia, specifically Alzheimer's, they have higher levels of that protein in their brain. So, one could potentially say these things are related somehow. And sleep gets rid of this protein that has been increased in people with brain diseases. So
Interesting.
That's really cool too.
Wow. So I know that with sleep, it's important to have a certain amount of hours, and it's important also to have good quality sleep. I feel like there's a lot of different ways to navigate how to get started. Like, where do you kind of start when you're thinking about, I know I need to address my sleep?
So I think to first get into it, it's really important to understand more about sleep and how it works, because when I was learning about the sleep stages and how it benefits your body, that's when I kind of came up with these strategies and realized that, how to make it work for me. So there's different stages of sleep, and we'll kind of simplify it. I'll say stage 1 and 2, those are lumped together. So this is kind of your lighter sleep. When you first lay down, you're feeling maybe kind of dozing. You're easily awoken though. And then stage 2, which is lumped in, basically the same, but we would see brainwave changes if we were to hook your brain up to an electrical monitor. These first 2 lighter stages, those are ideal for power naps. So you're usually in those stages for about 20 to 30 minutes. Something, just to weasel in a small fun fact of what I used to do on test days during medical school, is there's something called a caffeine nap.
Oh.
And what you do is you drink a cup of coffee. Generally, the onset of action for caffeine in a typical cup of coffee is about 20 or 30 minutes.
Okay.
So that's how long it takes for the caffeine to take effect. Well, also, the ideal length of a power nap is 20 to 30 minutes.
Oh.
So you just down a cup of coffee, take a power nap, and then when you wake up, it's like you doubled down. Because,
oh my gosh, I love that.
So if you need a jolt, that's a great strategy.
Light bulb.
Can I get a nap right now? I just drank a cup of coffee.
Okay, so pound a cup of coffee, take a 20-minute power nap. You're going to wake up double awake.
Yeah, because the way that coffee works is that it blocks this chemical. It's called adenosine that makes you drowsy, sleepy, brain fog. So coffee makes that chemical less active. And when you sleep, your body gets rid of that chemical. So now not only do you have less of that sleepy chemical because you just took that power nap, but you're also blocking that sleepy chemical that you have with your caffeine. So it's a little
I love it.
That is what we call gold. Amazing.
So that's kind of like a fun way to increase your energy right away. But the meat of sleep, where the magic really happens, is during stages 3 and 4. And stages 3 and 4 include the deep sleep. That's the restorative sleep. This is have you ever taken a nap and you wake up and you're like, oh my God, what time is it? What
Where
day
am I?
is it?
Yeah,
Where am I?
Yes.
Did I oversleep? Am I supposed to be at work right now? And it takes you some time to get your bearings. Maybe you feel groggy or like maybe even worse than you did before you laid down for the nap.
Yep.
That means that you woke up during a deep restorative sleep stage. And then the other important part is rapid eye movement or REM sleep. And that's when you dream. So that one's kind of fun. And your body's also paralyzed, interestingly, during that time.
Really?
So question, I heard that if you're going to take a nap during the day, the best length is to do like an hour and a half so that you go through a full sleep
Yes.
cycle. So is it either do a 20-minute because you're not in that deep sleep yet, so you're not getting into full, or is it do a full sleep cycle? What's the answer?
Both work. It
Okay.
depends on what your goal is and how much time you have. The point of those time guidelines is to avoid getting into that deep sleep or waking up during that deep sleep. So if you do the 20 to 30 minute power nap, then you don't get into that deep sleep. You feel kind of restored. It's almost like you had a really good meditation or something. But if you're genuinely sleep deprived and you need a restorative sleep, each sleep cycle, you're right, lasts about 90 minutes for the average person. There's some variation, so just be in tune with your body and kind of notice patterns about yourself and see, do I fit with this 90 minutes? Is mine a little shorter? Is mine a little longer? But 90 minutes is usually a good place to start because then you go through those first 20 to 30 minutes of light sleep, you fall into the deeper sleep categories, stage 3 and 4. Perhaps you might get one cycle of REM in, and then after REM, you come back into those lighter stages for a little while, and that's the best time to wake up.
Okay.
And that actually gets into another really good strategy for optimizing your sleep overnight. Because just like if you take a nap and you wake up during those deep sleep stages, and you wake up super groggy and out of it, that can happen in the morning too.
Me every morning.
Yeah. Like when your alarm goes off and you're just like, I physically cannot move. Like even just slapping that like snooze button seems
You're
like
speaking my language.
like horrible, like the worst thing in the world right now. That means you're probably getting woken up from a deep stage of sleep. And that can be remedied by shifting your sleep either forward or backwards.
Okay.
Something that people often will notice is that they'll say, I try to sleep 8 hours a night, but I feel so much better if I only sleep 5 hours. Why is that? Well, it's not actually because you're sleeping 5 hours as opposed to 8 hours. It's probably more likely that you're getting rid of that disconnect or like interrupted sleep cycle, and you're probably waking up from a stage 1, stage 2, so you feel more energetic initially.
That makes so much sense. Oh my gosh.
Throughout the day, if you wake up in the middle of a sleep cycle, like we've been describing with the naps or when the alarm goes off, your brain, its number one priority actually is to finish that sleep cycle. Literally, it will take up like your cognitive space and your bandwidth because your brain is just like, I need to finish, I need to finish, I need to finish. It feels like it left this super important thing undone. And so
Yes, I can feel that. My brain tells me, like that thought you're thinking of, my brain thinks 15 more minutes. Like it tells me you need 15 more minutes. It's not finished, but that makes so much sense because that's literally, I think, probably what it's doing. And if I get those 15 minutes sometimes, I'm like, yep, that my brain told me that. Yep.
or like, when you're at work all day or, doing your daily routine and you're just like, I can't wait until I can go home and finally take a nap. That's probably because you're getting an incomplete sleep cycle.
So for someone who would love to get this complete cycle and wake up in stages 1 and 2, how do you plan your night around that? Hour-wise, or where do you recommend beginning?
So first, figuring out kind of what your sleep cycle length is. 90 minutes is a good rule of, to start with and kind of see how that works for you. So plan your night of sleep around 90-minute chunks. 2 sleep cycles is like 3 hours. So 6 hours, add another 90 minutes, like 7.5 hours.
Which is ideal anyway. You should be getting 7 to 8 anyways, right?
I feel like they say 7 to 8 for a reason because 7:30 is ideal.
Exactly. And a lot of times, you get to that 7.5 and then you just allow for like 20 minutes or something to fall asleep. So that's kind of where that guideline of 8 comes from.
Okay.
But that's not ideal for everyone, and you always have to listen to your body. I personally am probably someone that needs more like add another 90 minutes on top of that 7.5, so math.
9.
I'm definitely like a 9 plus, like the 20 minutes to fall asleep type person. Other people genuinely can function off of like a sleep cycle less. You just have to figure out what works for you. So now that you know what is the number of hours that you need to get complete cycles for you, you kind of plan backwards. Something I like to have people do is like, okay, imagine that you are on a paradise island. There's no work, there's no obligations. You don't have to like get up with your kids. You don't have anything. You don't have to make your yoga class in the morning. Like there's literally nothing. There's no screens. You're just out in nature, relaxed. Imagine what time you would go to bed, and then imagine what time you would just naturally wake up and feel well rested. If you imagine yourself sleeping like 12 to 14 hours, when I say imagine this like perfect scenario, that's probably a good sign that you are sleep deprived actually, because your brain is like, oh my gosh, I need more sleep. I need it at any cost. But everybody's circadian rhythm, that's the first time I've used that term, that's kind of your body's internal clock. So everybody's internal clock is very different. But society has this idea that we need to wake up and get started. Like all of our work always starts at like 8 a.m. or something. And you need to wake up at 6 or 5 to get stuff done. You need to go to bed early. And that doesn't always work for everyone. So if you have a career or lifestyle that allows you to be flexible, I would actually encourage you to listen to your body and go to bed when your body tells you to go to bed and wake up when your body tells you to wake up. That's not always realistic because we live in a society that has demands on us, and sometimes we need to be flexible and meet those demands. And so say you start work at 8 and you want to be able to wake up at 6 a.m. to give yourself adequate time to get ready for the day. So now you do math and you'd say, okay, 6 a.m., I'm going to give myself 7.5 hours so I get right on the sleep cycle. You would do the math and figure out what time you need to go to bed. And make sure that you're like in bed at that time. Now that's the easy part, even though it includes math. Now you need to tell your brain and train it to be sleepy at the right time and to wake up at the right time.
So you're trying to wake up at 6. So right now you're trying to get 7.5 hours of sleep.
Yeah, we'll round it to 8 to give you some grace period to fall asleep.
So you want to be in bed by 10, so you're asleep by 10:30.
Yes.
Okay, got it.
Perfect. I'm glad that you're like helping me with the math here. I used to be really good at arithmetic, but it's like the more medicine I learned, the more like useful daily knowledge was etched out of my brain.
Really?
Well, you're just putting so much in it. It's like, hold on, I need time to process this all.
Yes. And so like calculating tips at restaurants, doing math to figure out what time I need to do things, those skills have left my brain. So I'm
understandable.
I feel very grateful.
You
that
have bigger fish to fry with your patients.
So, okay, now your math bedtime is 10. You need to do a ritual. Our brains want everything to be efficient. We don't want to have to think too hard about anything, actually. And your brain does so many amazing things to just streamline and autopilot. And we can use that autopilot to optimize things, like feeling tired and going to sleep. So you need to do a ritual before bed that tells your brain, all right, I'm winding down. Yes. In order for your brain to feel sleepy at night, a few things need to happen. First, you have to have the right chemicals in your brain signaling that it's time to go to bed. One of those major players is called melatonin.
Love it.
Yes. And melatonin is secreted or made in your brain when it is dark out, or rather lack of light, especially blue light. We generally naturally get blue light from the sun. So before we had screens and artificial lighting, humans probably slept a lot more, had much more healthy sleeping patterns because our only source of light was the sun.
Right.
And that's what our body evolved to follow. And so melatonin usually spikes, if you have a good circadian rhythm that's nice and solid, about 2 to 3 hours before bedtime, actually. So if you're really serious about resetting your bedtime, getting your sleep on track, that means no screens for 2 to 3 hours before bedtime.
Which in today's society is like,
right?
how?
It's crazy.
How do I function?
I think people are like, I'll just wear my blue light glasses and then I won't have.
Are they really that effective?
You know, I think they're a good compromise.
Okay.
It's better than just staring at the screen full glare right into your retinas of your eyes, you know, and your brain being like, yes, bright light, yay, you know.
Keep me up.
Yeah, let's see another TikTok, you know.
Guilty.
Me too. But so blue light glasses actually are great. I would recommend blue light glasses if you absolutely cannot cut the screen time out.
What about during the day? I know some people swear by their blue light during the day. Does that have any effect?
That's a great question. So blue light during the day, you know, shouldn't really affect sleep per se.
Okay.
But other people are sensitive to blue light for other reasons, like migraines or eye strain or just kind of like mood or anxiety.
Sure.
So if you feel like you're affected by blue light or screens in that sense, you could always try the blue light filter glasses. Alternatively, on most electronics now, there's usually apps or settings. If you play around on your computer or your phone, you can usually find some sort of like nighttime mode.
Yeah.
And it will filter out the blue in the screen. It looks really weird at first, and your screen is like totally orange and the colors are off, but eventually you get used to it. And so that's another way to filter out the blue light. Getting back into melatonin and signaling to your brain how to wind down for the night. So that 2 to 3 hour range is important for other reasons too. So usually when you get that spike in melatonin, the light starts dimming, your brain starts thinking, okay, it's almost bedtime. If you think about your daily habits and what you do in the 2 to 3 hours before bed, what do we all do? For me, that's when I'm actually like, I'm cleaning my house, I'm planning for the week, I'm meal prepping, I'm doing all these really productive, really energy heavy things. Yep. And I need to practice what I preach a little bit better because actually, if you want to optimize your sleep, that should be a wind down time, meaning you should be doing something that's not super stimulating, ideally not with a screen, something that doesn't take a ton of mental or physical energy because your body just needs that time to get ready, essentially, because sleep is actually such a complex physiological biochemical process that happens in your body that your body has to genuinely prepare for it.
Yeah, which is crazy to think about.
Yeah. Well, and as a parent, that's like impossible because most parents get their kids home around 5:30 and they put their kids to bed at 8 or 8:30. That's 2.5 to 3 hours. Exactly what you're talking about. So in that window, you know, kids have homework, which is taxing on your brain. You have to use your brain. You know, parents are running them around. They're high stress. They're in traffic. They're picking up their kids. They're rushing around. They have activities. It's like, how do we even troubleshoot that as a parent, you know?
Right. And you're getting at like deeper problems in like how our society is structured. You know, American culture is so fast paced and so focused on productivity, and a lot of the value that we derive as a person is from our work and what we produce throughout the day. That's why America is one of the cultures or countries that has the worst sleep health and the most sleep deprivation and the most negative health effects from that.
And mental health.
As well. Obesity, diabetes, heart disease, strokes, dementia. I mean, we are not doing great health-wise. Compared to other cultures, even when they have fewer health resources than we do. And one of my opinions is that sleep has a lot to do with that. You know, when we look at other cultures that prioritize sleep more and actually will kind of base their societal scheduling more around sleep, they have much better health outcomes, much better mental health outcomes. They feel more connected with their family and community relationships and have higher rates of happiness, actually.
I feel like there has to be a balance between this go, 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 the doing and the being, and everyone, not everyone, but society, we're lacking that just being and that recuperating, restoring, so that we can do the doing.
Yeah, and thinking of other cultures, I think about the siestas.
Yes.
Or I think about how, like if you do go to Mexico, like resorts pretty much shut down from 2 to like 6 to go take a nap. Or like different countries, you know, maybe they're like, okay, we can only do so much of not being productive. Like we do have to work, but then you get a longer holiday or like spring breaks. Like they give you weeks off of work or months off of work, you know, and it's probably to, you know, catch up on your sleep, rejuvenate, reconnect, and even maybe strategize how to be productive and keep your sleep. You know, it's probably a good tactic.
Yeah, exactly. I feel like we are coming from like a deprived state all the time. We're always trying to catch up. And so something that I've recommended to some of my friends, you know, we'll just be talking, and even though, you know, I'll just be like chatting as friends, they still ask me a lot of like medical questions. They'll be like, oh my gosh, I'm so tired. I'm fatigued all the time. I have all these things I want to do, but I just like cannot muster up the motivation. And I'm always like, okay, how's your sleep? They're always like, garbage, you know, because I'm up all night getting stuff done for the next day. And I have to wake up early to be able to accomplish all the things that I need to. And I will often tell my friends to take a week off to reset their works or their sleep schedule if that's something that's available to them, if they have a job that's flexible enough for that. Because this actually, you know, we're getting into these strategies on how to train your brain when to sleep. And this can take 2 or 3 weeks before your brain like starts solidifying these habits. So consistency is definitely going to be key here. And like you mentioned, society sometimes doesn't let us have that 2 to 3 hours of winding down. One of the interesting consequences of not getting that 2 to 3 hours of leisure or relaxation time prior to sleep is something that I call like revenge insomnia.
I started seeing this all over social media.
Oh, I'm intrigued. What is that?
I love that it's becoming more mainstream because your body needs that time to prepare for sleep so badly that it will actually push your bedtime or push your feelings of sleepiness back until you've had that time.
It's like basically your day is devoted to doing everything for everyone else, that when you get home and you are in bed, you're like, I want this time to do whatever the hell I want to do.
So it won't shut down.
Exactly. Perfect. Yeah. So then once you finally get that like alone time or relaxation time, you know, it's probably when you should ideally be going to sleep. But that's instead when you spend a bunch of time scrolling on social media. Maybe that's when you read. Maybe that's when you do your beauty routine or your yoga, or, you know, you fill it with your you time that ideally you should have had 2 to 3 hours.
I feel like you're speaking to every parent on the planet.
You think
right
that
now.
it's helping you because right now social media and health and wellness, right, is preaching this self-care. And there's a lot of people that can say, hey, this is my me time. This is my self-care time. So when am I going to fit it in? How do I fit it all in?
Well, and that's the battle with the parent. It's like, I've literally done everything to keep these kids alive, and I've worked. And now I'm supposed to go to bed the second they go to bed. Literally, when is my time? So that the only answer for me is yes, go to bed when they go to bed. Set up. I mean, the kids have a bedtime routine. We do it for them. We get them nice and sleepy. We read them a nice book. We get them all relaxed. We get them all cozy. And then what do we do for ourselves? Nothing. So now I'm like, okay, I used to be a night owl and that used to be my time. But now I'm like, no, because then I work out at night and then I'm up because that makes me extra awake. So I just flipped it. I'm like, they're brushing and flushing. I'm brushing and flushing now. I've got my face routine then now. Thank you, Brooke, for helping me get that set up.
Got you.
I face plan in my bed. I go to sleep when they do. And then I just get up 2 hours before them. And then that's my time. And so that's my fix. Like, that's the only answer I can come up with being a parent.
Do you feel like you're getting enough quality sleep by waking up those 2 hours earlier?
Now I do.
Okay.
Which I didn't think I would. But I do because I honestly think it's because I have their bedtime routine now. I honestly
Become
think
your bedtime routine.
Yeah, it has. It truly has. I'm like using my kids' routine to filter into getting myself, and like those are my signals now, and it's working. I feel more awake than I've ever felt.
And I think you point out something that's really important to especially women who are often seen as the caretakers, that we do so much for other people our kids, our loved ones, and then you don't do that for yourself. And so many times the answer is how you take care of everyone else should be how you take care of
yourself.
you.
Yeah.
Yeah. And so you got it exactly right. You're getting the kids all relaxed, doing all their rituals so they know, oh, this is bedtime. And by virtue of that, you've created a ritual for yourself as well.
I'm curious what your thoughts are on night owls versus morning early birds.
I think if you have a flexible job that allows, and you're a night owl, and you're truly a night owl, not that you're doing this revenge insomnia or this like procrastination
You
thing.
just notice that you work better later at night?
If you just notice that your cycle is a little bit later, I think that's totally fine. That used to be called delayed circadian rhythm syndrome. So we used to define that as a sleep disorder.
Interesting.
But I don't like that. I think that humans are just unique. You know, we're not going to all be uniform, even though we kind of have uniform societal obligations. And so I think that has less to do with what is internally wrong with someone in their sleep pattern and more to do with their individual needs aren't necessarily compatible with the needs of the majority of society or what society expects of them. And so if you find yourself being a night owl, see if you can get a job that works with your schedule. Every once in a while, I have a schedule, it's called swing shift, and I actually love it. So we start working at 3 p.m., and then our shift usually ends around 11 or 12 at night. And when I am on swing shift, I feel like $1,000,000. Like I go to work from 3 to 12. I come home. I have my like wind down time after work. Usually end up going to sleep around like 2. And then I wake up naturally, beautifully, without an alarm clock at like 10 or 10:30 in the morning. And I just feel so rejuvenated. I can work out. I can meal prep. I can clean my house. I can engage in some sort of hobbies before it's time to go to work at 3. The only downside is that schedule is not what all of my friends and loved ones are on. So then it gets a little isolating. But, you know, I think about that all the time of like, you know, if we could only have more flexible schedules for people who kind of naturally have a delayed rhythm, that would be perfect.
Well, you'd be more efficient in your work. It's a win-win.
Like as long as you're getting your work done and it doesn't
Right.
have to be in these hours.
Yeah.
I mean, it's tough when you have meetings that you have to align with other people or
Exactly.
you have different time zones or whatever. I totally
Yeah.
understand how you kind of have to, but I can't imagine, and I'm super excited because I have a vacation coming up. I'm going to try this. Just waking up not to an alarm, which I know there's different ways. You have a really cool alarm clock too, but
I want to hear about the alarm clock.
yes.
Is it a light one?
Yeah. So Sonia, who we had on the podcast, she saw and was listening to a different podcast we had where I talked about my relationship with the snooze button and how I set an alarm every minute. Just a very bad habit because getting out of bed is really hard for me. And so she recommended the Hatch alarm clock, where it's the light, and then it also, so the light starts coming on, you can set whatever color light you want. So I have it usually set at 4:30 it starts, and then it's a slow rise. So then at 5 I have the chimes go off, and then it does like a morning meditation that slowly gets me up.
Is it training you to become a monk? Like, are you going to be at a monastery
God,
soon?
I wish. No, the problem right now is that the woman's voice is so soothing that it goes straight from like the chimes to her voice, and then I fall back asleep to it. So I can't do that yet. But there's also a night feature where I hit it. It goes on at a certain time, and then it walks me through, or it puts on a light first. It gives me 30 minutes of reading time, and then it does a night meditation, and then it goes into like a noise machine, a sound machine. And I still have to have it away from my bed so that it forces me to get up and turn it off. So it's like it's slowly happening, slowly getting to it.
You need a chick on there that's like, yo, Brooke, wake up, it's time.
You a badass. Wake up. Yeah. But I think that what you're saying about the 90 minutes and figuring that out is super key, and I haven't thought about that before.
Yep.
Because I wake up every morning just like, oh, which I know a lot of people do. Yeah. So it's a slow process, but it's happening, and it's getting me into a night routine and a morning routine and setting up this perfect sleep environment.
And I love that because that's using so many great scientifically based strategies, especially I like the noise machine part of it. And so that gets me into, now that you've had your time to wind down, you've done your nightly ritual, next is setting the stage or the environment for sleep. That means dark, no light, ideally no screens. I think the easiest first step is get that TV out of your bedroom. And if you can, no laptop in the bedroom. And if you can charge your phone outside of the bedroom at night, do that too. And that's going to be the biggest thing for environment. And make sure the temperature is comfortable, make sure the bed is comfortable, all those decorative pillows, get rid of them, toss them, throw them on the floor, And something that, an unpopular opinion is to not let pets sleep in your bed too, because they're rustling throughout the night. They wake you up. It's really fun and amazing to cuddle them, but they do cause micro awakenings throughout the night and interrupt your sleep cycles, definitely. And so creating a space for yourself where sleep is really the only thing that's associated with the bedroom. Really, your bedroom should be for sleep and sex only. Literally nothing else.
I like it. That's interesting too that you mentioned the phone, because the phone even gets in the way of sex. Like if the phone goes off and sleep. And so I know that you can like turn your sounds off on your phone, but like the light will come up on your phone if you don't flip it over. And so I need to get a separate alarm clock, I think.
Yeah. Where do you find that happy? So for individuals who their job relies on it, or, emergencies, we don't have home phones now. What do you say to that argument?
And that's kind of the piece of, you have to take all of this information with like, what works for you? Yeah. Take what works, leave the rest, take what resonates, take what is realistic for you to use. If you went ahead and did every single one of these tips that I'm sharing, you would be the most disciplined. Like,
I'm trying.
I would be like, wow, you are like hardly even human if you're able to actually follow all of this. I try, but we're all human and we all kind of like, have our compromises. But if you're in a space where you're saying, I'm just sick of being tired, I'm sick of being fatigued, I want to make changes in my life that will improve my sleep and improve my health and my energy, then these are things that you can think about if it works for you.
Yeah. I love it. I love what you said too, is like, just take one tip. It'll make it better. Yeah. Take a few. Take them all, and man, hats off to you. But I think that's the whole idea, is that everyone has a different scenario. And so what works for you, try a few of these things, try one of these things. I mean, and think about how it could apply to what you're doing now and, your job or.
Right. Like if you're a mom and you have interrupted sleep, that's not really something that you can work around. Griffin, night terrors, like you do what you can, but there's other tips that you can add in to help.
Speaking of, can I pick your brain about night terrors?
Yeah, let's hear it.
Yeah. So, my son, it's genetic. My husband has them. And my son, who's 5, which I've heard, and I'm really praying for, that you grow out of them, which I don't totally believe, because
your husband still has them.
My husband still has them. And it is really rare. He has night terrors like, my husband has them like once every 6 months, maybe. And they're wild and scary, and he's screaming or he thinks there's something in the room. But my son, I do notice as he's getting older that they are less frequent, and I'm noticing patterns. If he's overly tired, that they're worse. But yeah, I just want to know, like, what is that? Like, what is going on, and what can I do besides keep him on this routine of getting to bed at a normal time?
Yeah. There's so many interesting points to this. So night terrors, or when you kind of like act out dreams, maybe screaming, fighting, whatever, that is actually your body failing to paralyze your body, or your brain fails to paralyze your body during the rapid eye movement. So basically you're like acting out dreams, nightmares, that kind of thing. And generally you don't remember most of your dreams, nightmares, that kind of thing, unless you wake up during the rapid eye movement sleep cycle. A lot of times if you're having night terrors, you're like getting out of bed, you're fighting, thrashing, whatever. And so you wake up and then you remember them, and then it's very distressing, and it can negatively affect your sleep because it's like stressful. And it's interesting that you notice those patterns with your son, that if he's more sleep deprived, that they happen more often, because that is a direct cause of sleep deprivation. We have something called REM rebound. So it means that more of your sleep cycles are devoted to REM, or you spend more of your time in REM than you normally would had you been not sleep deprived. And so he's having more of those opportunities for that paralysis to fail.
It's a hard cycle because it's like you're super tired because you had night terrors all night.
Yeah.
And so then you're overly tired going to bed, and then it's like he can't catch up on it. You know what I mean? It's like super hard. It's like we have to be so diligent with his routine, and we're also super social people. So it's like sometimes we have people in our house and then they don't go to bed till 10 on the weekend or something. And it's a really hard thing to stay disciplined with because of our lifestyle. And
Well, I've also heard too that you can't, like, there's no such thing as catching up on sleep.
No, you really don't catch up. I think over time you could kind of balance out or get back to a not sleep deprived state. But, you know, if you only sleep 5 hours a night all throughout the week and then you try to sleep in on a Sunday, it ain't going to do it. You know, in order to catch up per se, you would need to have a disciplined sleep routine for weeks to months for your body to get used to that new sleep balance. And then, you know, maybe you could call yourself caught up because you're not sleep deprived anymore, chronically speaking.
yeah, I know there's a lot of sleep disorders. I hear about them all the time with my coaching clients. Like, have you seen in your career, you know, any other sleep disorders?
Definitely. I'd say the most common one is probably sleep apnea. And that really negatively affects your sleep because it affects your breathing and you don't get enough oxygen. You build up carbon dioxide in your body, and then your brain actually wakes you up slightly, just enough to make you start breathing again. And so you have these kind of micro awakenings throughout the night. And so you don't get the deep restorative sleep that you need. You wake up, you feel super tired, like you might fall asleep during the day. Some people, it's so extreme, they'll fall asleep when they're driving or things
scary.
like that. So if you think that you have something like that, one of the main symptoms of sleep apnea is snoring, or if your family members have sleep apnea, that would be something that you should consider asking your doctor about. Like, hey, I'm really sleepy. I'm having these symptoms. I snore. Do you think I could have sleep apnea? And you should talk to your doctor about it. And there's really easy testing now. Sometimes they can even do sleep studies at home and give you a diagnosis. And usually if you diagnose and treat that, it's like a world of difference.
What does that treatment look like?
So the treatment for sleep apnea it's called positive pressure oxygenation, basically. So it's something called CPAP. And so it's like this mask that you wear on your face. It creates a seal and it just kind of pushes air into your nose and mouth, and it keeps like your air tubes all nice and open so you can continue to breathe throughout the night. Because when you sleep, all your throat and like mouth muscles all relax. And sometimes, you know, just genetically or bad luck wise, it'll be too narrow and kind of close off and block breathing for some people. So when you add some positive air pressure, it keeps it like stented open so air can get in and out much easier.
I have a few questions about sleep apnea. One, I've heard that's really uncomfortable to sleep in. Is there any other alternative to that?
So the masks themselves have had a lot of innovations in the past few years. So, you know, if you or a family member has sleep apnea and you're like, oh, this mask sucks, like ask your sleep clinic if there's any alternatives, because they'll actually like find a mask that really works for you. But if at all costs the mask is just like, this ain't it, there are other alternatives. They're a little less effective, but you know, probably better than nothing. There's like a dental like implant. It kind of like thrusts your jaw forward to keep that airway clear. Sometimes there's different surgeries that they can do actually. But my favorite is definitely the CPAP. And if at all possible, just trying to find a mask that works and is comfortable enough, because if you can figure out how to fall asleep with that on and you just get like a few good nights of sleep, you're going to be like, oh my gosh,
It's worth it.
it's worth it. Yes. You'll be like, oh my gosh, I can't even sleep without my mask. I want it, you know, because it makes such a big difference on how you feel the next day.
Yeah. And then my mom might have it. She's unsure. And so it's like getting the person to do the sleep study is hard. Like people just, you know, time and it's money. And then the machine sometimes costs money. So it's like, would I even be able to afford it? I don't know. But when we were at a clinic, I was with my mom and the doctor said, if you have sleep apnea, you are shaving off days and weeks and months of your life. You need to get this tested. So I heard that and I was like, I mean, I know sleep's important, but is this true? And so how do you feel about that statement?
I agree with that. I'm like, oh yes, that's so powerful. I love it. Like I'm going to start incorporating that when I talk to my patients about sleep and sleep apnea. You know, kind of like getting back to what we started this talk with. So many important things happen during sleep. And when you're not getting good sleep, your risk for heart attack, stroke, your blood pressure, your weight, your insulin management, your body, all of those things get worse if you're not sleeping right. And, sleep apnea is one of those things that can negatively affect your sleep quality.
One of the things you just said, you're mentioning all these different, like the insulin and all these different hormones and everything and weight. And I think something people are always asking us is, how do I boost my metabolism? Sleep. What does your sleep look like? It's usually like the biggest, and nobody wants to.
But also no one talks about it. Like, this isn't really common knowledge.
Yeah. And the way that sleep can affect metabolism is there's multiple ways, but the main ways are first, insulin resistance. This is something that causes weight gain and it causes type 2 diabetes. And if you are sleep deprived, you're more likely to have insulin resistance. So therefore, if you get good sleep, your body manages insulin better, manages its blood sugar better, manages your metabolism and your weight better. So that's one way. The other way is when you don't get enough sleep, your body tries to conserve its energy and it uses it for only the most vital survival activities, essentially. And so we have so many different parts of our brain, and I like to call like your survival part of your brain your lizard brain, because it's like a lower form of your brain, and like reptiles have this part of your brain. This is the part of your brain that says, I need to eat, I need to sleep, I need to
rest and digest.
Sometimes, like sex drive is associated with that part of the brain. But we as humans, we have evolved another more powerful part of our brain called the frontal cortex. And that's essentially where all of our higher level thinking and regulation comes from. That's the part of your brain that says, I know I'm sleepy right now, but I need to finish this thing real quick. I know that I'm hungry and I will get food soon, but I can do this. It's what emotionally regulates you. It allows
it's like your reasoning.
Yes, it's your reasoning. And when you are sleep deprived, your frontal cortex takes so much energy. So when you're sleep deprived, that part of your brain is much less functional. And so not only are you not going to be as good at remembering things, learning things, cognitively functioning, but you're also going to be much more impulsive, because now your lizard brain
is like, eat, whatever's in sight. I need food. I'm going to die.
Yes, exactly. Your lizard brain is going unchecked. There's no frontal higher level brain saying, I know you have these needs and we'll get to them. And instead you're just like, chips, food. And you're much more likely to make poor health decisions regarding what you eat. It's okay to be hungry and it's okay to eat when you're hungry. But when you're sleep deprived, you're more likely to grab the quick option.
I think about relationships too. You're quicker to say hurtful things. You're quicker to react to
Right, you're
people.
not pausing and actually thinking about what you are going to say and its effects.
So that gets into a really fun fact, actually, about good quality sleep and appropriate amount of sleep, is that people who reported poor sleep were much more likely to argue with their significant other the next day. And people who have good quality sleep and adequate sleep are more likely to report happiness within their marriage.
So is that why my boyfriend is so nice to me? Because he's obsessed with sleep?
It might be.
Great sleep.
It's definitely part of it. Definitely
I'll
piece to the puzzle.
I'll respect his sleep wishes now. Now I get it.
Another point too, if we're interested in how sleep and relationships intertwine, couples that have the same bedtime or go to bed at the same time report higher levels of relationship satisfaction. And even if one person is a night owl and one person is prefers to go to bed early, even if the night owl will lay down with the early bedtime person and stay there until the earlier person dozes off, that actually releases a lot of attachment hormones, the love, the happiness hormones, and relationship satisfaction is increased when you have the same bedtime.
I heard too that this cuddle hormone or whatever gets released and your your rhythms start to beat together. Have you heard that?
I don't know if they necessarily beat together. I haven't heard that part, but I could imagine that would definitely, like, that could definitely happen because you're right that it affects your heart rate. It can slow it down. And that's another thing that leads to better sleep is a slower heart rate. It's something that melatonin does. It's something that having that like wind down period at night has. It's something that happens naturally in the sleep cycles. So, you know, that could definitely be playing
They're
into
both
it.
slowing down at the same time.
Yeah.
Makes sense.
You're in sync, you know?
Yeah.
That's nice. If you're having trouble with interrupted sleep, say you're waking up multiple times during the night, something that's good to know is that it's actually normal to have light awakenings up to 10 times a night.
Okay.
Sometimes people will wake up that many times in the night. A lot of people don't remember it. So everyone wakes up, has micro awakenings throughout the night. It's when you are between the sleep cycles. So you probably wake up, you know, about every 90 minutes, but you don't really remember it. Some people do, however, remember it. And it can actually be kind of distressing because you're like, why am I awake? I want to be asleep. So sometimes just knowing that it's normal. You just kind of notice, I notice that I'm awake and I would like to be asleep. Okay. Now you can move on, put your mind to rest. But sometimes it goes beyond that. And some strategies for if you are awake and just cannot get back to sleep. A lot of us will just lay in bed and like stare at the ceiling, try to count sheep, like try to will ourselves back into sleep. And that often doesn't work. And sometimes that can actually worsen the problem.
Because you're stressing about it.
Because you're stressing about it. And because, like we mentioned before, your brain wants to put things on autopilot. So if you're creating this habit where you're laying awake in bed, stressing out, now your brain is like, oh, this is what I'm supposed to do. Yes, I do this every night. So I will put this autopilot on repeat and I will do this every night. So if you're waking up in the middle of the night, you're having a hard time going back to sleep, you should actually leave your bedroom. Get up, go in a different room, do something, you know, kind of comfy, low stimulation, maybe like read a book with very dim lighting, something that's kind of boring, you know, until you feel sleepy again. And then you go back in your bedroom to sleep. Because you do not want to associate being awake and being stressed out with being in the bedroom. One word of caution, when you choose your activity to do not choose anything rewarding. You know, so if you're waking up at night and you're like, okay, I'm laying awake here. I'm supposed to leave the bedroom. I think I'll pack my lunch for work tomorrow because then, you know, I'm going to be all set up for my day. You're going to pack your lunch and you're going to get like a little reward.
Hit a dopamine.
Yes, exactly. And then your brain's going to be like, ooh, I like that. I like that reward. So now guess what? Your brain's going to be like, hey,
I'm going to pack my lunch every day at
time
4
to
a.m.
wake up and pack that lunch because remember how good that felt to like get prepared for the next day? Now you're perpetuating the cycle. So you need to choose something incredibly boring, not rewarding.
Interesting. But it totally makes sense.
But what if you choose meditation, that's boring, that's relaxing, but it's got the blue light and it does give you a benefit.
You could do a meditation that doesn't include a screen, right?
Yes. Okay. That's what I would recommend.
Okay.
Maybe something with audio only, or if you know, sometimes you could maybe memorize like a short meditation or a self-guided one.
Or square breathing even.
Would you recommend that you stay in bed to do the meditation or that you get out of your room to do the meditation?
I would still recommend getting out of the room so you don't associate being awake in the middle of the night with being in the bedroom.
And then the minute you get sleepy again, just go back to bed.
Then go back to bed.
Love it.
And then should we talk about morning routine?
Please.
Because we talked a lot about bedtime routine, and I think that morning routine is actually almost more important than your bedtime routine to setting your circadian rhythm.
Okay.
So how do we wake up? So ideally, you should wake up when you're in those stages 1 and 2 or between stages. That's when you're in the lightest level of sleep. You should wake up. That's when you feel the most well-rested and alert. I love that you use that alarm clock that has the light because one of the most important signals to our brain that it is time to wake up is light, and especially sunlight. And that is really powerful to setting your circadian rhythm. So it's like, this is our number one. And if you wake up, you know, we live in Minnesota where it's super dark out until like 9 a.m. or something.
Yes.
So there are strategies to kind of get around that. And that's why I love the use of a light alarm clock. Or there's these things called SAD lights. They were originally invented for seasonal depression, but we've found that they're really effective in helping people with delayed circadian rhythm or trouble waking up, or if you're trying to solidify your sleep schedule. So when you wake up in the morning, if you turn on this really bright light, a SAD light, it's called SAAD.
Can I get this on Amazon?
Yes, you can. You can actually. And one specification that I would add is that you should get something that says 10,000 lux.
Okay.
It basically is a measurement of how bright the light is, and that's the one that mimics the sunlight in the spectrum of light that you would receive from the sun.
10,000. Okay.
10,000 lux.
Yeah, something I do too, because I heard this too, that you want to have the brightest light you can in the morning, because that's exactly what it's doing. Is I cannot see myself. I don't want to track my REM sleep. I just, as much as I know that that's going to be helpful, I feel like that's going to change based off of when my kids wake up, if they wake up in the middle of the night. And I just know, like, whether I feel great or crappy, I need to be up at 5 a.m. or earlier to get things done. That I think I just choose to focus on the light. Like I have a really bright light in my workout room, and that tends to work for me. Does that make sense, that that's just what I put in my face right away?
Yes.
Okay.
You instinctually got one of the best strategies for solidifying a wake up time.
Okay.
Because light is the most powerful signal to your brain as to when you should be awake and when you should be asleep. It's so powerful actually that people who are born blind have a lot of trouble with circadian rhythm, and they have a lot of sleep problems because they don't sense light in the same way.
Yeah, that makes sense.
So bright light right in the morning, I would recommend probably like an hour of bright light right in the morning, right when you wake up, kind of off to the side of your face at like 30 degrees. It's so specific, and it probably doesn't matter that much, but that's what was used in the most research studies. So that's kind of what we base it off of.
Interesting.
It's got me thinking about next step, because the alarm clock, I love it, but I need something else. So I've been thinking about this lately. So it's funny that you say that okay, so my alarm clock goes off. I sit up. I wait a minute before I turn it off, because usually I'll get up, turn it off, and immediately crawl back in bed and then have an alarm every minute. But so I'm thinking, and I've been thinking about this for the last couple weeks or so. So it's funny you say that, is getting up, sitting up, waiting a minute, telling myself a mantra, turning my alarm clock off, and then the cue of turning the alarm off is to immediately turn on my nightlight so that I have some sort of light. So I need to build that habit. But I think that if I purchase this SAD light, it's going to get me jacked. I just keep purchasing things, I feel like, to help. One of these has to stick.
And, it's really about consistency, discipline. It's about training the autopilot part of your brain.
Yeah.
So your brain gets on this very regimented schedule, and so it will take over. If you stick with this habit, eventually you won't even have to think about it.
It's the goal.
Yeah, exactly. And you're having such trouble with the alarm clock. Once you get to a point where your sleep cycles are lined up in a good way, where you wake up kind of naturally at like a good transition point in the cycles, and if you're not chronically sleep deprived, the ideal thing would be that you wake up with the light signal and you won't even need an alarm.
I can't even imagine.
It's the end goal.
Yeah. I've probably achieved that in my life for maybe a 6-month period of time before life takes over. And, it's hard to stay consistent and stay on top of these things. But
especially for you, you're a doctor with changing schedule. Like, I can't imagine.
Gosh.
And I have a lot of clients that have that shifting schedule and they go from these hours to these hours. So how do you adapt that? Like, how does that work for you?
If you realistically can't go to bed exactly at the same time every day, wake up at exactly the same time every day, you can still use these strategies to kind of manipulate your sleep time to, maybe you're not that tired. Maybe it's not your normal time to go to bed. You can do your sleep routine. You can use these strategies to try to get as good of sleep as you can realistically in the period of time that you're allowed to sleep. That will allow you to at least get better quality sleep within the time allotment that you're given. If you can line up all of these things on top of each other and get the best, most optimized sleep, that's great. If you can apply a few of these things and just make small changes that make you feel better, then that's great too.
Yeah, I feel like they're just these simple strategies that you can implement whenever. And the more you do them, the more your brain is associating it and will remember it. So even if you fall off track, it's easier to get back on because you've been consistent before. Your brain recognizes it.
Exactly. And you can use these signals to your brain to change the schedule, essentially. Like when I go to a new schedule and I have to start waking up 2 hours earlier, then I'll probably use the light more, the light strategy, because then my brain will be like, oh, I'm supposed to be awake now. And it's kind of funny, in a lot of our workrooms as residents, we actually have the sad lights in the workrooms.
Oh, really?
So that's part of my routine, actually, at one of our hospitals. I go in the workroom, I chart all my patients, I look at their vitals and their labs from the day before, and I have that light on. And when I'm at that site that has those lights, I feel so energized, and it's when my sleep schedule falls into place the best, because I associate that signal. Because I don't actually own one of these lights on my own. I really intend to purchase one, but
I'll let you know how I feel about it, how it works.
And I've been just mooching off the ones that we have at work, and it's been working for me. But if I ever changed work sites or something, I probably would invest in my own, because it really has made such a big difference.
And I love that there's all these little things that you can do to trick your brain. Little hacks.
Yes.
So I'm really getting into my morning routine, and I'm getting obsessed with it. So I know that it's working. I'm feeling the benefits. And right now I'm playing around with when to have coffee. I've read things that are like, wait 30 minutes. No, it's fine. What are your thoughts on that?
Yeah, so I love coffee. Recently, it was my favorite research article ever in a medical journal. That makes me sound really nerdy. But in the New England Journal of Medicine this summer, there was an article about caffeine and coffee, and basically like all the amazing health effects of coffee. Basically, you live longer, you function cognitively better, lower rates of cancer. It's just like, oh my gosh, this is amazing.
And you can run a marathon faster.
Yes. That wasn't necessarily in this article, but I have heard that, and it's true. To get at when the best time to drink your morning coffee. So one of the signals that your body has to wake you up is something called cortisol. So this is a hormone that often gets a bad rap for being the stress hormone, but it's actually really helpful in your body in a variety of ways, and it's necessary. And one of its necessary functions is that it spikes in the early morning, not too long before you wake up, maybe a few hours before you wake up. And that's what tells your body, all right, it's time to get jazzed. Like, bring that heart rate back up, bring that blood pressure back up, wake this brain up, let's go. And so that's spiking kind of right as you're waking up. So if you drink coffee on top of your cortisol spike immediately, like you roll out of bed and you drink that coffee, you probably won't feel that coffee effect as much. And over time, your body could come to rely on the caffeine more, and it could decrease your cortisol spike. Not significantly, but you might feel the energy differences. So the best time to drink caffeine actually is when you have cortisol lows. And those times often, if you have like a typical sleep schedule, would be mid-morning, like 9 or 10 a.m. and also mid-afternoon. So when you're like at work or something and it's like 2 or 3 and you're just like, oh my gosh, I need a nap. That's because your cortisol is low. And so those times when it's dipping are when caffeine will have the most positive effect on your energy, and it won't change what your cortisol spike is. So it won't affect what your energy is like based on that.
That's so interesting.
So hold on, let me unpack that. If I wake up at 5 a.m., I have to wait 4 hours to have a cup of coffee.
So, 5 a.m., that's a little earlier than like my default scheduling that I'm thinking. So I would say you would probably have your coffee around like 7 or 8.
That makes sense to me, though. That makes total sense to me, because I wake up, I'm pretty much blacked out. I walk to my basement, turn on the bright lights, and I get into exercise, which gives me that boost. So it's like, if you get your heart rate up with exercise first, if you can.
Get some endorphins
get that from that. Because I noticed that too, that if I have a rest day with exercise, like I don't wake up and instantly think I need coffee that moment.
Yeah.
Unless I stayed up way too late or something. But that makes total sense, like around that 9 to 10, that if I already had that boost, then I get a lull a couple hours later. I'm going to try that.
So 3 hours after you wake up, you would wait?
Yeah, like 2 or 3 hours.
Okay.
Usually the routine, how I incorporate that into my routine is I wake up and I get ready for work, eat breakfast, if it's a good day, drive to work. And then I have my first cup of coffee like as I get to work. And that tends to be kind of right where that low period is.
Okay. On the opposite side of that, when do you recommend stopping drinking caffeine?
Caffeine, for most people, will stay in your system for probably about 4 to 6 hours.
Okay.
However, there are a lot of genetic variations in caffeine metabolism. So some people metabolize caffeine much faster, And these people are more likely to be addicted to caffeine and have high levels of caffeine intake. And that's actually why sometimes in families, you'll see like the mom drinks like a pot of coffee every morning, like my mom does. And now I'm noticing as I'm becoming like into my older adult years, I'm like, oh, I need a lot of coffee to function. This is another example of there's kind of a generalized time of 4 to 6 hours, but you need to pay attention to what yours is. And so for some people, it is okay to drink caffeine during that afternoon low that we were talking about. But for other people, it's not. And the caffeine will stay in their system long enough to negatively affect their sleep that night. So I would recommend, if you're having a hard time sleeping or if maybe you're feeling like your sleep quality isn't great, see if you can go without the afternoon caffeine
and just see how it affects you.
And see how that affects you.
And would you want to wait like that 2.5 hours before bed to have it be out of your system by that point or by the time you're falling asleep?
Ooh, good question.
Ooh, that is a really good question. Probably before, probably the 2 to 3 hours during your wind down time, because you probably shouldn't have caffeine or stimulants in your system while you're trying to wind down. I think for me personally, when I try to do that, I do get probably better sleep, but I think when I have the afternoon caffeine, it doesn't make a significant difference to me. And I'm like, okay, my quality of life is so much better if I have like a 2 p.m. coffee. And so that's what works for me. So I encourage you guys to just kind of like play around with it. Give it a few weeks without caffeine in the afternoon, see how that works for you. If it doesn't make a difference, then, enjoy what you enjoy.
Yeah. Just become aware and in tune with how it affects you and
exactly
go from there.
And your relationships, because if you're super grumpy, it might be worth it to have a little bit of caffeine.
Right. And actually, while you're making this change, caffeine withdrawal is really common.
Yeah.
So if you're making the change, give yourself at least like 2 weeks before you say, okay, this isn't working, because you might just be experiencing caffeine withdrawal, which is hard to deal with in itself.
And slowly wean off of it if you notice that you're getting crazy headaches.
Exactly.
Well, I just want to be mindful of your time and our listeners' time. I mean, we could go on for hours. This has been fantastic.
Yes.
So thank you so, so much. We're so grateful that you're here with us today. Do you have any last comments, any wrap-ups?
Well, first of all, I'm just so happy that you invited me to talk about this, because I'm sure you can tell I love talking about it. But I guess my wrap-up would be everyone is completely unique and has different health needs, has different sleep needs, has different demands set upon them. And so when you're listening to this, pick out what works for you and see if you can apply it. And things like this actually have really great like repeat value. So if you listen to this today and you say, oh my gosh, okay, I can apply these few things. That's what works in my life right now. And then if you listen to this in a few months, you might be in a completely different space and you can get new things from it. And you can apply different things and different strategies. And so I really encourage you on your health journey, to do that with, every strategy or optimization approach that you take. Figure out what works for you. Try different things. If it doesn't work, throw it out. If it works, then keep it and, improve your life.
Absolutely. I love that so much. And so that you don't forget to revisit in a couple months, don't forget to hit subscribe so that you never miss an episode and that you can always revisit the episodes. Well, thank you so much.
Yes,
Before we jump into our 3 gold stars, please remember that all of our resources are available to you for free at all of our social channels. With that being said, if our listeners want to reach you, where can they find you?
Yeah, so the social media that I'm most active on is Instagram. My Instagram name is at Danielle the Doctor, Danielle, the Doctor. So you can follow me there. But I don't really post a lot of things about health or my profession. I actually, I keep it pretty real. So if you're interested in getting to know me more just as a regular person or seeing what the normal life of a doctor is like, go ahead and follow. But I don't share a whole lot of health stuff. It's more just fun and hobbies and kind of like a regular person.
It's so refreshing though. I think it's so nice to see that doctors are real people. They have hobbies that you might not think. Like, you never know. Like, I mean, you'd look at you and know that you're beautiful, but you don't know if someone's in a pageant or something like that. It's so interesting to see like what you're up to and that you are a normal human being that struggles with things like everybody else, and you're taking steps to optimize your sleep just like we need to.
Yeah, exactly.
Totally. Well, Danielle, we wrap up our show with our last 3 segments. So the first segment is our 3 gold stars. So these are 3 actionable takeaways that we can give our listeners. So without further ado, it is now time for 3 gold stars.
So the first gold star is that you need time to wind down at night. Your body needs time to prepare for sleep. And so take 2 to 3 hours at night to make sure that you are incorporating leisure and relaxation, because rest is just as important as productivity is. You can't have one without the other. The second gold star is to create a bedtime routine, whether that's beauty routine, meditation. And in that routine, I would recommend getting rid of screens if you can and reducing artificial light and really getting into the environment in which you sleep and creating that routine, that ritual, that space that tells your brain, all right, I am ready for a great night of sleep. And the third gold star being focusing on your morning routine, figuring out where your sleep cycles naturally are at their lightest or at their transition periods, using that 90-minute time frame so that when you wake up, you are feeling alert, not groggy or disoriented, and really optimizing this for you and customizing a sleep plan for yourself.
All right, next up, unleashing Ivy. So these are our rapid fire questions. So first thing that comes to mind could be a word, a phrase, first thing that comes. All right, first one. How do you create awareness around your quality or quantity of sleep?
The first thing I notice is how easily do I get out of bed and how many times do I need the snooze alarm? I think you and I share that problem. So if I'm really doing good, I actually will wake up like 10 minutes before my alarm is set. Ooh. And my alarm is more of a safety measure than something that I rely on. And if I'm not doing so great, then man, that alarm goes off and I can't even move. And I just let that alarm keep going because even like reaching and clicking snooze is like so much work. So that's a really good gauge for me to know, am I applying these strategies in a way that's helpful for me?
What do I need to adjust?
Yes.
All right. Love it. Next one. When you realize your sleep schedule is off, what's one thing you do that steers you in a positive direction?
Definitely the screen time, because that's the thing that sneaks up on me the most. My biggest mistake is I do that revenge insomnia thing. I'll go, clean my house, make dinner, work out late into the evening. So then when it's actually time for bed, it's actually when I start my wind down time. And my wind down time for me is social media, watching TikTok, watching TV. You know, it has everything to do with screens. So if I notice that my sleep schedule is getting out of whack, that's the first habit that I have to get rid of, is the late screen time.
Love it. All right, and last one. What's one thing you wish you would have known sooner?
It's funny because I feel like I've prioritized sleep really my whole life without having the scientific understanding. I just kind of intuitively knew this is incredibly important. My parents were super strict with bedtime. Like my entire life, literally until I graduated high school, my bedtime was 9 p.m. And I think it had everything to do with my success. You know, I was pretty decent at athletics. I was good at school. I was involved in, creative things and extracurriculars. And I continued that productivity and was really proud of my accomplishments and my energy level well into college and adulthood. And it was probably because of the discipline that I kept around sleep that was instilled by my parents. And I'm really grateful that they did that for me. I feel like I just intuitively knew this. I would have loved to know all of the scientific and like fun facts and how to optimize like caffeine and like the caffeine power naps.
Yeah.
Some of those things, little things that make me have a deeper understanding of the scientific, biochemical, physiologic reasoning behind sleep. But intuitively, I knew early on.
That's
awesome. not much earlier could have I kind of found this life hack.
Very cool.
All right. And for our last segment today, your piece of gold.
Our piece of gold is from Maria Popova. We tend to wear our ability to get by on little sleep as some sort of badge of honor that validates our work ethic. But what it is a profound failure of self-respect and of priorities.
This is Gold Ivy signing off.
Listen to your truth and go chase your gold.